Podcast 5 of the Upper Limb series. The muscles of the anterior chest wall and the arm. This podcast is going to focus on the anterior axio-appendicular muscles of the chest and also the muscles of the arm. So let's start by looking at the anterior axio-appendicular muscles, which include pectoralis major, pectoralis minor and serratus anterior. And these muscles connect the anterior chest wall to either the humerus or the scapula. The most superficial muscle of the chest wall is the large fan-shaped pectoralis major muscle, and this covers the costal surface of the anterior thorax. It has two heads, the clavicular head and the sternocostal head. The clavicular head originates from the anterior surface of the medial half of the clavicle, and the sternocostal head originates from the sternum and the superior 6 costal cartilages. The fibres of both of these heads travel laterally and taper to a narrow insertion point on the intertubercular groove of the humerus. Lying deep to pectoralis major is pectoralis minor, and this is a smaller muscle that originates from the 3rd to 5th rib and extends supralaterally to the coracoid process of the scapula. Both of these muscles are supplied by the pectoral nerves that come from the cords of the brachial plexus. The medial pectoral nerve branches from the medial cord of the brachial plexus and supplies both pectoralis major and minor. Pectoralis major also receives innervation from the lateral pectoral nerve, which branches from the lateral cord of the brachial plexus. Pectoralis major is primarily responsible for adducting and medially rotating the humerus at the glenohumeral joint. Pectoralis minor works alongside pectoralis major and stabilizes the scapula. The final anterior axio-appendicular muscle is serratus anterior. This muscle occupies the lateral aspect of the thoracic wall and forms the medial wall of the axilla. It originates from the superior 8 ribs and extends posteriorly, then medially, to wrap around the lateral margin of the thoracic wall, and it attaches to the anterior or costal surface of the scapula's medial border. Contraction of this muscle protracts the scapula, holding it against the thoracic wall. It is supplied by the long thoracic nerve, and damage to this nerve results in winged scapula. So now let's turn to the muscles of the arm, and there are 4 muscles that can be divided into 2 compartments. These 2 compartments are separated by the medial and lateral intermuscular septa, and these extend from the humerus to the skin of the arm. Anterior to these septa is the flexor compartment of the arm, which contains coracobrachialis, biceps brachii, and brachialis muscles. It also contains the brachial artery, the basilic vein, and the ulnar, median, and musculocutaneous nerves. Posterior to the 2 septa is the posterior compartment, and this contains the triceps brachii muscle, along with the radial nerve and the deep artery and vein of the arm. So let's start by detailing the musculature of the anterior compartment. So coracobrachialis is a short muscle that originates from the coracoid process of the scapula and extends inferiorly to the medial 3rd of the humerus. As it only crosses the glenohumeral joint, contraction of this muscle causes flexion and adduction of the humerus at the glenohumeral joint. Lying lateral to coracobrachialis is biceps brachii, and as its name suggests, biceps brachii has 2 heads, a long head and a short head. The short head also originates from the coracoid process of the scapula, but the long head originates from the supraglenoid tubercle. This is a small bony elevation on the superior margin of the glenoid cavity, and from here the long head of biceps extends within the joint capsule of the glenohumeral joint and descends within the intertubercular groove. The long and short heads of biceps then converge as a common muscle belly and attaches to the radial tuberosity of the radius. As it attaches to the radial tuberosity, It also sends a small tendinous band across the cubital fossa to merge with the fascia of the forearm's flexor compartment. You'll notice from this description that biceps brachii doesn't contact the humerus at all, and it crosses three joints. It crosses the glenohumeral joint, the elbow joint, and the proximal radio-ulnar joint. Because of this, biceps brachii has a wide range of movements. Initially, contraction of biceps brachii will supinate the forearm at the radio-ulnar joint, and only then, once the forearm has been supinated, will it then flex the forearm at the elbow joint. Further continued contraction can lead to weak extension of the glenohumeral joint. So biceps brachii is responsible for supination and then flexion of the elbow. Finally, it can extend the glenohumeral joint. The final muscle in the anterior compartment of the arm is the deepest flexor muscle, and this is brachialis. Brachialis is a flat muscle that lies deep to biceps brachii, and it attaches to the distal third of the humerus and extends inferiorly to the ulnar's coronoid process. Brachialis is the chief flexor of the elbow joint. All three of these muscles, so coracobrachialis, biceps brachii, and brachialis, are supplied by the musculocutaneous nerve. Posterior to the lateral and medial intramuscular septa is the posterior compartment, and this compartment contains the triceps brachii muscle. This muscle has three heads, the long, medial, and lateral. The long head originates from the infraglenoid tubercle of the scapula. This is a small bony elevation on the inferior margin of the glenoid cavity. Both the lateral and the medial heads originate from the posterior surface of the humerus, with the lateral head coming from above the radial groove and the medial head coming from below the radial groove. All three heads merge into a common tendon that crosses the elbow joint and attach to the olecranon of the ulna. Triceps brachii is responsible for extension of the forearm at the elbow joint. All three heads of triceps brachii are supplied by the radial nerve, and this enters the posterior compartment by emerging through the triangular space in the posterior wall of the axilla. Running with the radial nerve is the profunda brachii artery, or the deep artery of the arm, and this is a branch of the brachial artery. Both the radial nerve and profunda brachii artery supply triceps brachii by running along the spiral groove of the humerus deep to the lateral head. The final and often forgotten muscle of the arm is anconeus. This is a small triangular-shaped muscle that sits on the posterolateral aspect of the elbow and is thought to assist triceps in extending the elbow. So to finish the podcast, I'll remind you that there are three anterior axio-appendicular muscles that extend from the thoracic wall to the humerus or the scapula: pectoralis major, pectoralis minor, and serratus anterior, and that the arm is separated into an anterior compartment which contains coracobrachialis, biceps brachii, and brachialis, and the posterior compartment which contains triceps brachii. In the next podcast, number 6, I will detail the cubital fossa.